A second American infected with the Ebola virus is now in the United States and getting treatment under quarantine. But the question many are still asking tonight, could we see an outbreak of the deadly virus here, similar to what they have in parts of Africa? Tonight, SNN's John Woodruff asked Suncoast experts to weigh in on the new global health scare.
With 2 Ebola patients now in the United States, one of the biggest public fears is the disease spreading beyond a controlled treatment center. But infectious disease specialist Dr. Vilma Vegas says the possibility of that happening is very low.
It isn't something that is easily caught necessarily on in airplanes or airports. It's not like that.
Unlike an airborne virus, Ebola requires direct contact with the bodily fluids of an infected person, something Dr. Vegas says there are precautions against.
We shouldn't be scared of this disease coming here and all of a sudden that we're going to be acquiring this or passing it amongst people. We shouldn't have a mass hysteria.
When the second missionary infected with Ebola touched down in Atlanta, the disease was a trending topic on Twitter. At nearly 500,000 tweets, the only topic more popular than Ebola? Gaza.
When we show panic, we communicate. We begin to infect others with misinformation or fear information. And so it blows up, and the public now has a perfect means to do that.
Clinical psychologist Dr. Eddie Renier says Ebola represents many people's biggest fear, the unknown. But in making that unknown into the known, he says we need to learn to deal with being constantly plugged in.
We need more experience in how to handle information. We need more experience in how to handle false information, partial information, and to how to make decisions about the news that we receive.
Reporting in Sarasota, John Woodruff, SNN, the Suncoast News Network.
And while there is no known cure for Ebola, although both U.S. patients have undergone experimental treatments for the disease, doctors say a new vaccine study will start in September, and they hope it will help us better understand this very dangerous virus.